You're listening to GradCast, the podcast and radio show of Western University. I'm Elizabeth Mohler. I'm your host. My co-host today in the seat is Ariel, and we are joined by Francesco Colosimo. Hi, Francesco. How are you?
Hi, everyone. How are you today?
We're good, but we're really excited, Francesco, because we're going to hear about your research, and it's very timely, very pertinent, and extremely important. So tell us, just to kick us off here, a little bit about your program and your work.
Yeah, so thank you, Elizabeth. So right now I'm doing a Master's of Health Information Science. I'm in the second year of doing that. And like you said, I'm doing some research that's very current to today's climate. And I'm looking at, the health information that is emerging in today's society regarding the topic of COVID. And right now I'm in the process of looking at all the literature that, surrounds that's coming out about that. And I'm hoping to draw some conclusions that, for public health purposes, we can look to and, structure certain things in the future. What I'm looking at specifically is the integrity of the information coming out, also known as misinformation. So whether the information is trusted, whether it's correct, as well as, the certain methods and channels that some of this information is being disseminated, and the connection between the integrity of the information and those certain channels, as well as certain ways that public health organizations and government organizations can communicate this very, vital information regarding COVID and other things in such a great way and in the most efficient way that'll instill, the best behavior change and the best safety measures to be uptake, whether that's wearing masks, social distancing, etc.
All really important stuff. Maybe before we jump in too much further, could we backpedal? Could you tell us what exactly is health and information science?
Yeah, so that's a good question. That's a question that, me and my classmates, we get a lot. And the simplest answer is health information science doesn't have a definition. Well, it does, but you can almost define it in any way that you like. And you can frame your research in any way that you like, as long as you justify it. So health information can take on a number of things. I have colleagues doing research in public health and public law, and they're looking at, the construction of health policies and the way we can make the best policies. I have classmates that are looking at AI and disseminating health information with AI and health-related apps. I have classmates that are looking at health information and how certain treatments get to rural populations in Canada. So I guess going back to what I originally said, we look at health information and we like to frame that in different ways depending on the research that, we attempt to attack. And for me, health information for my specific research is, the information that is being disseminated from governments and public health agencies to the population. So I'm looking at it from a very broad level. But you can narrow it, you can go from, the broad level in which I'm looking at all the way to patient-physician interactions and stuff like that. So it's not a certain thing. Not all of us in our program, look at certain things or research certain things. But we all start with the broad term of health information science and then try to define it and justify it with our own research and with our own data.
When you were talking about, information, i.e. also misinformation, this is really interesting, or I feel invested emotionally a little bit in this because as a scientist, when I see misinformation, I feel like it's sometimes my job to combat it. I have to say, hey, wait a second, I'm a scientist. I'm trying to tell the world about my science. And if I see someone spreading misinformation about science that I'm knowledgeable about, I feel like I have to correct it with the correct information. Where are people finding their information? I mean, I feel like sometimes people come up with, I heard this somewhere. What sources of information are you looking at?
Yeah, so that's a great question. And that's definitely one thing that I'll be looking at, through the lens of COVID. But through the literature that I've been looking at, I think most of the time the misinformation is unfortunately coming from social media, whether that's Twitter, Instagram, etc., Facebook. And the very problematic thing is that while most of the information comes from social media, more often than not, people get most of their news from social media as well. So it's kind of a double-edged sword where as we're progressing, we are seeing more and more people getting their news from social media, but more and more misinformation popping up on social media. Where in the past, people were getting their information through, the news, newspaper, and different TV outlets and news outlets that is more controlled by the government and more controlled by organizations that can fact check the information, and make sure that, the information being disseminated is proper and it's correct. And there right now are not a lot of measures on social media, the big three, Twitter, Facebook, and Instagram, ensuring that the information that's going up, especially regarding very serious topics, is actually correct.
That's interesting that you bring that up, the big three. How do you think this idea of misinformation starts? Like it's really interesting to think about all of the different outlets we have available to us in this digital age that we're in, and we're even more digital now, being that we're stuck at home. So how do you think this kind of misinformation starts?
Yeah, so I guess part of the reason why I think that it's on social media, I guess just to go away from your question a little bit, I think part of the reason why it pops up on social media the most is that it's anonymous. The fact that it's anonymous and that, people can really post anything from an anonymous point of view, as well as for the first time almost in history, anyone has, the platform to reach large amounts of people, where in the past, it was very hard to reach a large amount of people. Now through social media, that's become possible. So the fact that it's wide reaching and it's anonymous, the actual source of misinformation, for that reason is actually very hard to determine, or why certain people choose to attempt to circulate, bad information or misinformation. And there doesn't seem to be a reason why, for very serious topics like COVID, that someone would want to circulate, incorrect information. Unfortunately, there's no data about that. There's almost very little way that they can investigate that. So the reason in which people try to circulate misinformation is unknown. Maybe they want to create a little bit of anxiety and havoc. But I think the way that this misinformation seems to gain traction is through the widespread nature of social media and the fact that its source is anonymous.
I mean, maybe I'm just a little bit cynical, but I've always been pretty skeptical of the open use of social media. People are just like, yeah, I'm going to put all my information out there and I'm going to just engage with it to my heart's content. I've kind of felt maybe it's kind of an antisocial tendency, but I've not wanted to engage with social media in that way with people. But in part, it's also this kind of icky feeling that there's a corporate interest that's governing what I do on this platform, and their interest isn't really to provide me something that I like, but to make money. And the question is, how are they doing it? So, I mean, maybe one thing that comes to my mind is misinformation gets eyes, gets clicks. So there's a monetary incentive potentially there, because the more clicks you get, the more money you could get, regardless of why they click. Does that factor in, or do you look at monetary incentives behind where information is coming from?
Yeah, so that's funny that you touched upon that. And I recently read an article in The Economist that said, out of all the resources in the world, in today's society, data is actually the most expensive resource, and it surpassed oil. And wow. Yeah, and unfortunately, just away from my research and just for conversation, unfortunately, there's conspiracies that all of our data is being mined for, we don't really know the purpose. And, the whole controversy about targeted ads, I think we all believe in those right now, where we'll Google search something, or we seem to just talk about something to a friend, and, we get an ad for that exact same thing. So that's an obvious indication, or an obvious case of them monetizing off that information. Now, based on, going back to your question, if misinformation is circulated for the sake of, profiting, it's possible. If it's kind of a throwaway news source where, some news sources that we know are kind of, they can't be trusted. Maybe they get paid for clicks. Maybe they get paid for likes. Maybe they're paid to circulate that information from someone else, who knows? But, big data in general is, I think, it's a bit of a problem, because there's so much data coming out right now. Not just about COVID, but, everyone using social media, everyone using their electronic devices. This is all data that's being created, and the policies and the laws haven't really kept up with, the culmination of all this data. And it may not even be illegal to harvest it and sell it at this point. And it's just, it's a bit of a free-for-all right now, and they're starting to learn that in Europe, and they're starting to make regulations around that in Europe, harvesting big data and then selling it for different purposes. So I think, policy and we have a lot to do in realizing, how serious, if we think about it on a broad scale, how serious this can be if all of our data is being mined and used for a specific purpose. And we don't even know at this point. So, but yeah, back to your question, for sure it could be monetized in ways I don't even think we could know yet.
Do you have, are there particular aspects of information being circulated on COVID that makes it ripe for study? Why COVID?
Yeah, so I guess we chose to study COVID simply because, as this whole epidemic or pandemic progresses, there's just so much information coming out right now. And it's the first time, for me, that I remember that, all of this health information is coming out in real time, and you could almost see it progress. And it's a really good way at, evaluating and critiquing certain, strategies and ways that governments and, health agencies are disseminating the information to the public. And it's a really good way of trying to figure out, okay, which strategies were beneficial, which strategies worked in, getting the population to wear masks, getting the population to socially distance, or, maintain their interactions to a certain number of people, or, which countries, seem to have a really good, health information communication strategy, and their numbers were lower versus some of the other countries where they may not have been successful, indicated by, measurable factors that I just talked about. So I guess going back to your question, COVID just gives us an opportunity to, in real time, kind of analyze the ways in which right now health information is being communicated to the public. And it's quite, terrifying, but kind of exciting at the same time.
You mentioned some strategies around what's worked, what hasn't, in terms of getting people to wear a mask, getting people to comply with social distancing and numbers. What are some of those strategies that maybe have worked and maybe some that have not worked so well?
Yeah, so I really, in my research, I intend to really get into the details of, the frequency at which messages from the government or health agencies to the public were disseminated, through which channels they were disseminated, and even, the nature and kind of the tone and the information and the way that they chose to frame the message. For example, in North America and in the UK, a lot of the COVID-related messages to the public seem to be very information centric, these are the numbers, this is what's happening, this is what you should do. And it was almost very serious and, in a way meant to instill a little bit of fear, versus some of the other countries, around China who are very close to China, but actually their numbers early on for COVID were actually very low, like Singapore, South Korea, etc. And it looks like, in the early stages, their messaging was very frequent. They chose to use social media platforms that were very prevalent in those countries, like WeChat, like WhatsApp, like Weibo, and so forth and so on. And their messages seem to be very positive, instead of information centric. They used a lot of hashtags, stay strong. They tried to instill an environment of rallying around healthcare practitioners, or, trying to instill a sense of, or an environment of, we are in this together. And it seemed to have worked to some regard, and they seem to be, very willing to adhere to, some of the measures put in place for safety in those countries, versus some of the other countries where, the messages and the way in which it was disseminated didn't seem, as successful. We all know how high the numbers were in the US, in the UK, and the population seemed to be, less willing to adhere to these measures. And I'm not saying that is because that's a result of the way they frame their messages, but it's just a way. It could have played a factor for sure, and just simply in my opinion. So those are the things that I'm looking at. So frequency of the messages, the way that they were disseminated, as well as, even the language that were used in these messages to pretty much convey the exact same information. So for a health information point of view, it's actually quite fascinating.
When you look at, if you're looking across the world, at these different countries and their messaging, are you going, when you look at trends, will you stratify or separate into groups, countries whereby the government has more control of that messaging versus countries that don't? So I think that there's this real sentiment of freedom of the individual in North American countries like Canada and the US, where we really feel like the government, when we speak on social media, the government shouldn't have anything to do with that. Whereas maybe I'm wrong, but I get the feeling that in China, you just don't have the freedom to speak say whatever you want on social media. They kind of can just block whatever they like.
Right.
The government, so to speak.
So that's definitely a limitation of this research that I would love to point out. The fact that, in analyzing the social media data from some of these countries, they may, there's always the possibility that they suppressed, some of the true sentiments of the population, and, or, suppressed, who knows, even if the numbers, like the COVID numbers that they're reporting, are truthful. That's something that is scary to think about, but is out of all of our control. So, as I do this research, I got to take the data at face value, and just hope that, I could take, we can take aspects of, maybe some of their public health strategies in disseminating this information, stuff that, can be universal without, trying to hone in on some of the data, because all we can do is take it at face value at this point, even though, it may not be 100% truthful, but unfortunately that's, I guess, a conversation for a different time. It's something that we may never know.
Laura here. I would like to ask a question just while you were talking. I was thinking if you also explore any strategies to fight misinformation, because if you focus a lot on that, I would like to know what else can we as the public do, or what other strategies are out there to, like fight that problem?
Yeah, no, that's a great question. So, I've been seeing, a number of proposals to fight misinformation, and fighting misinformation comes from two areas. It's, the people posting the misinformation, whether that's news outlets or social media platforms, etc. They have a responsibility, in my opinion, to make sure that the information that they are disseminating regarding, especially serious topics is factual. But I think us, consumers of this information, the general population, I also think that we have a responsibility to not take everything that we read on face value. And just the other day, I saw a stat that, the news and the information that people see on social media is the most trusted news from their point of view. So, for example, if they see some news on social media, they see it in the newspaper, they see it on television, they're most inclined to trust the social media um, information, and the stats are saying that they should say the exact opposite. Now, from a governmental or a public agency point of view, one thing that they can do to kind of combat misinformation is using social media and their resources itself to kind of gauge what their population is thinking and what their population is believing at the time, and then disseminate their own information to combat that misinformation. For example, early on, there was a lot of news going around saying that people not showing symptoms may not be able to spread the virus. And just as an example, if they use their own resources to know that, on a general scale, this is what the population is thinking, they can then, disseminate their own information knowing that this is not true to correct that. Another way I know it's already in motion, like for Twitter, Twitter is looking into, putting disclaimers on certain things saying, they're not saying that the information is wrong or it's not factual, but they're just putting a disclaimer beside certain things saying, basically read this with caution and, make a judgment for yourself. So those are just some strategies, and, we got to do our part in not taking information at face value, as well as, those actually transmitting this information, they have the responsibility of, making sure that it's good information.
It's interesting. You've mentioned good information, misinformation, information. Boy, there's a lot going on out there in the world. How does the common person who's just sifting through things, and maybe Twitter is their most common place where they go to grab information, how do you know what's credible as a consumer of information? How do you know what to believe?
Yeah, so the data right now is showing that information coming from, government agencies and or health agencies, for example, the CDC, and so forth and so on, Health Canada, the data is showing that these are the most trusted sources. And, on a personal kind of level, I would like to say, you could read social media, you can read some of the more official top level information, platforms like government websites. But I think it's really important that to get the true picture, the true information, I think everyone should visit multiple sources, just to confirm that what they're reading is true and what they're reading is right. So to answer your initial question, I think if you're looking for the most factual information, it's that coming from the government. But to get, it can't hurt to get, the bigger picture and, the viewpoints of a number of different sources, and just making sure that you're getting your information from a number of different sources, so that, you can then look at everything and make, the judgment for yourself and say, okay, I believe this to be true because there are a number of sources saying this. And that's all that you can do, in my opinion.
You'd mentioned earlier in the interview that anonymity was a major factor here. Would you, if someone, let's say someone was completely naive to social media and they said, hey, I want to get involved in this. I want to go on social media and I want to talk to people and I want to be informed. would you be pointing them to different social media platforms based on whether they're going to be interacting with people who are more anonymous or less anonymous? I mean, I'm just imagining an angsty teenager who just decides it's fun to say that, you should point a hairdryer in your mouth and that'll kill COVID. And then it just spreads because that angsty teenager had a weird idea that he thought he would get views on TikTok for like, it could just literally start like that. So, I mean, would you rather point them to a platform where pretty much everyone's been verified, or does that factor into whether you should use a social media platform for information or not?
Yeah, that's a great question. So, most of us have social media in this day and age. I for sure do. And I'm never going to say, don't get social media. For sure, get social media, post pictures, communicate with friends. But you just got to be cautious in what information you're sharing, because it then becomes public information. And you have to be careful of what information you're reading on those sites. And to answer your original question, no, I wouldn't recommend social media for, very serious factual information regarding COVID or anything else. I would, recommend going to a newspaper or going to a government website. That is where the most, factual and correct information is. So to answer your question, no, I wouldn't recommend social media for, to gain information, but for sure, but I'm not saying don't have social media. Have fun on social media. Just be careful of what you're consuming as well as what you're posting.
So with that, we're coming quite almost to the end here. And you mentioned, use social media, and you use social media yourself. Maybe you could tell us, what social media do you use? Not necessarily for information purposes. As you said, it's not the best place to get your information, but in general, if people wanted to find you on social media, where could they find you?
Yeah, so I'm most active on Instagram and Facebook. And you can find both. On Facebook, I'm just Francesco Colosimo, my name. And on Instagram, my handle is francesco.colosimo. Feel free to shoot me a message on either if you have any more questions. Not too active on Twitter, so if you decide to send me a message on that platform, you may not get a timely response. But I would love to, talk about this topic, even outside my research, because it's something that I clearly read about on my free time just out of interest, and I think is pretty interesting. And I find myself fortunate that I'm able to, do some research in something that I'm so interested in. So yeah.
Well, thank you, Francesco. This has been a really enlightening interview. You've been listening to Gradcast, the podcast and radio show of Western University. I'm your host, Elizabeth Mohler, and I'm joined today by my co-host, Ariel, our producer, Laura Baena, and our guest for today's show, Francesco Colosimo. If you've liked what you heard, feel free to join us on the radio at 94.9 FM. You can find us on social media, Twitter and Facebook at Gradcast Radio. You can also check out our YouTube video for a whole list of episodes. Maybe you'd like to get in touch with us, perhaps be on the show yourself. You can do that by emailing gradcastradio@gmail.com. Thanks for listening. Have a great night.